Welcome back for the second portion of Joy in Our Town. Thank you for joining us once again. I am your host, Joyce Johnson. Our guest for this segment is Joyce Johnson, Director of Outreach and Cessation Services for the Breathing Association. She joins us today to discuss chronic obstructive pulmonary disease, along with the factors that contribute to development of this disease. Thank you so much for being here with us today.
Thanks for having me here today, Tammy.
You're welcome. So COPD, I know I said it, chronic obstructive pulmonary disease.
Yes, that's correct.
Before we get into what that is, give us a little bit of information about your responsibilities with the Breathing Association.
My primary responsibility there is to do COPD outreach through a program actually funded by Franklin County Senior Options. We have a very high percentage of breathing problems in Central Ohio. So my goal, I have a three-pronged program through that grant, and I go out and do individual home visits to people who've been diagnosed with COPD and basically help them better understand what is happening with their lungs and their breathing and how to deal with a lot of the symptoms and side effects of that. And then I also can link them with other services within the community that might be helpful for them. I also lead support groups for people with breathing problems. We have one in the north end of town and one on the west side, and always looking for new members. But I have been a respiratory therapist for my entire career, over 40 years, and I think that I know a lot about breathing and trouble breathing, but the people who come to the meetings who actually live with the problem share so much valuable information amongst each other. So that's always a rewarding experience for those activities. And then I do group education out in the community, primarily to senior groups to help them better understand COPD and recognize how to recognize it earlier and deal with it.
I feel comfortable breathing just from you saying all that.
All right.
So tell us, what is COPD by definition?
By definition, well, the initials, as you said, chronic obstructive pulmonary disease. So chronic means it is there, it's not going to go away. It is considered a progressive disease, although it progresses at different rates for every individual. Pulmonary disease means it's having to do with the lungs, and the word obstructive is actually the key word. There are things that are obstructing you from breathing as well as you should. So COPD is a big term, I call it an umbrella term, that covers emphysema and chronic bronchitis and often asthma. And those diseases are lumped together because they have similar symptoms, they have similar treatments, and most people have a little bit of both of those things, or sometimes three things going on with their lungs.
How is it diagnosed? Is it something that the doctor would catch?
Yes, well, this is my thoughts on that. Often when we go to the doctor, we're going for a specific problem, and as you probably know, you sit in the waiting room and wait for the doctor to come in. So unless he asks specifically about your breathing, you don't always volunteer that information, and if he doesn't see you come in or leave, he may not notice that you're short of breath. So sometimes a lot of people feel that being short of breath is part of the aging process, and it's really not. The primary way is through an easy test, a breathing test, sometimes called a pulmonary function or a spirometry test, and that can pinpoint actually where in your lungs the damage is and how it has progressed. It can also be diagnosed with a chest x-ray or just a history of chronic cough or breathing problems for long term.
Wow, so is it diagnosed as COPD, or could it fall under a different category like asthma or something?
Well, it's funny you asked that. Sometimes people call me and they say, my doctor told me that I've got emphysema and chronic bronchitis and COPD. And I said, well, you really just have COPD because that covers those others. So sometimes they're relieved to hear they just have one problem instead of three.
Right. That makes sense. So how is it, once you diagnose it, how is it treated?
It's treated with various medications. And I'll go on to say, as far as the diagnosis, as I said, most people think being short of breath is part of the aging process. And when they finally do get diagnosed, it's often after they've had an acute exacerbation. Suddenly they just can't breathe well at all, and panic goes right along with that. So they end up in the emergency room or at the doctor's office, and then it's diagnosed with COPD. Wow. It's typically in people probably 45 to 60 years old is when it's initially diagnosed. And there has been a push nationwide for doctors to do the simple breathing test earlier, especially for people who have a history of smoking, so that it can be diagnosed earlier and treated earlier, and therefore prolong their life.
So are younger adults, are they exempt from this, or?
No, no. I've seen people, very early in life diagnosed. Now, there is one genetic factor that can run in his family. It's very rare, and that is usually tested now at an earlier age as well. But it affects different people at different rates.
So tell us the two different types of COPD and how they are, and how they affect the lungs. Yeah.
Okay. Well, as I said, the two primary diagnoses are chronic bronchitis and emphysema. And our lungs are comprised of about 1,500 miles of airways and about 600 million little air sacs, or alveoli. And I like to think of them as little Pac-Man because they gobble up the oxygen when it gets in there. With the chronic bronchitis, the lining of all those miles of airways becomes irritated and inflamed, and in turn your body creates mucus in there to protect it. Well, the mucus makes you cough, and the coughing makes it irritated, and the irritation makes mucus, and that just goes on for some people for years, and that's sometimes what we hear is referred to as a smoker's cough, that kind of rattly cough that you hear in some people. Now, I'll step back from that a moment and say that most of us experience acute bronchitis periodically through our lifetime. So that's not necessarily a precursor for the chronic bronchitis. It's called chronic if you've had 2 long-term episodes in 2 consecutive years. But with the bronchitis, as I said, it's primarily the lining of the airways is irritated, and that obstructs the breathing as well.
So you've mentioned it a couple of times. Is it safe to assume that smoking is the leading cause?
Smoking is definitely the leading cause. Secondhand smoke is also ranked right up there. And most people over 40 have been exposed to secondhand smoke at some point in their life, in your workplace, in your home, wherever you used to go.
Yeah, I was like, can you explain that a little further? Because I know, there was this big talk about secondhand smoke some years back, but now it's kind of deceased. Tell us how important that is.
It is very important. I'm working with several of the local senior residence buildings because they want to go smoke-free, and now it's actually a HUD mandate that they be smoke-free. And so, unfortunately, the people who are affected are sometimes been smokers for 30, 40, even 50 years. So it's a very difficult addiction, and certainly the people in the apartments around theirs are concerned about the secondhand smoke because they do share ventilation and common hallways and places.
So
like
how
that.
close do you have to be to someone to get that secondhand smoke to where it causes an issue, or is it something that happens over time?
It happens over time, and now they have recognized what's called third-hand smoke, and that is the toxins from cigarettes that remain like in the drapery, the upholstery, the paint on the wall. So someone could be a heavy smoker and move from that home or apartment, and someone else moves in and they're breathing the old toxins from the secondhand smoke.
That's horrible.
It is.
Wow. Okay, so tell us about the pulmonary rehabilitation. How can someone with COPD benefit from that?
What happens often when someone's diagnosed with COPD is they've already started limiting some of their activities because they don't want to become short of breath. So once they get the diagnosis, I would say there's also a degree of depression and apathy, and sometimes guilt goes along with it, as well as panic and anxiety, because once they've had that horrible experience where they just don't feel they can get another breath, that leaves a blueprint on their brain. So the next time they start feeling a little short of breath, that panic kind of takes over. So all those other factors impact someone with COPD. The pulmonary rehabilitation program is a very structured program where they go into kind of like a gym-like facility and work out with doctors and nurses and respiratory therapists in a goal to strengthen their entire body. If a lot of your energy is going towards just breathing, you don't get to accomplish a lot of other things that you want to through the day. So by building up their stamina, building up their energy and all their muscle mass, that can help get through the day and deal with a lot of the shortness of breath and just have more energy to live their daily life.
That makes a lot of sense. So how can someone prevent, besides being a non-smoker, how can someone just prevent themselves from getting it?
Well, unfortunately, smoking is, and secondhand smoke are the primary causes, but also there's the environmental factor. And as I mentioned, in Central Ohio, we don't have good air quality. And sometimes we watch the Weather Channel and we see these big storms coming at us, and occasionally they split and bypass us, and we're all pretty happy. But that actually crushes the bad air down lower, so we're breathing higher particulates of the toxins. So be aware of the air outside in your own home as well. You may have mold or mildew or radon or asbestos or multiple other things that can affect your breathing over time. So if you think they're there, you ought to try to alleviate that problem.
Can you balance that by using some form of a humidifier or something like that?
Well, humidifiers add more humidity to the air, and especially in the summer, our air is pretty humid as well. Some people are very interested in air purifiers, but I would caution that some of them actually create more problems because they take some of the good stuff out of the air and throw the negative ions or the negative back out at you. So if someone asks me, I usually refer them to the EPA website, which lists, the benefits of air purifiers and also the ones that you would want to look for.
Yeah, that makes sense. Kind of like an antibiotic.
Actually, yes.
Yeah. So as we wrap up our time together, what's some advice that you could give people who maybe they are having breathing issues and they're not sure if it's COPD related? What are their first steps just for the assessment?
I would say recognize your symptoms. If you have shortness of breath with exertion, or throughout your daily life, if you have a daily cough that's been there for more than a couple weeks, if you wake in the morning and cough, or just have any of the primary symptoms are the shortness of breath, the cough, and an increased amount of mucus. So if that's something that's going on, I would make sure and mention that to your doctor. If he doesn't have the spirometer to do the breathing test, he can certainly refer you to someone who does. It's a very simple test. You can do it as an outpatient at the hospital. Awesome. That's the easiest way to identify it. And then when you get medications, use them properly. I see a lot of people who only use their medications when they're having a bad day, and some of them are designed to reach a level in your bloodstream to alleviate the problems before they happen. So take your medications, get your flu shot, your pneumonia vaccine. Avoid people who are sick. Avoid dirty smokers, dirty air. I will mention a lot of people are affected by strong odors like perfume and scented candles, and that can really take somebody's breath away. I think one of the things that I see on a regular basis is people say, I had to quit attending church because everybody wears perfume and powder and they all want to give me a hug and I can't breathe. So I don't want to tell them don't hug me, so I just don't go. So that's something you don't typically think about as being a problem for someone with breathing problems.
That is so much to take in. Thank you so much for being here with us today.
Thanks for
we really
having me
appreciate
today.
you being here. You're welcome.
All right.
That's our program. Thank you so much for watching. You can also check us out on Facebook at WSFJ-TV51. Join us again next week at the same time for Join Our Town.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, 7790 North Central Drive, Lewis Center, Ohio, 43035.